Hi, everyone. Welcome to a Senior Citizens Forum presented by Benefits for You Too Insurance Services. I'm Janice Wood, and my guest today is Amber Voitenko from Voitenko Wellness. She's been with us several times over our last 2 seasons, and she is a wealth of information that's real important for our health. Not only is she a chiropractor, she's gone back and become a nutritionist. I can't even remember all the different certificates and things that she has. She's really interested in how the body works. But real quick, before we get into our subject today, which is diabetic neuropathy, I'm going to talk about myself. I'm a licensed insurance agent. I've been doing this for over 12 years. I do Medicare insurance. And right now we're coming to the end of the open enrollment period, which ends on March 31st. That's when if you have a Medicare Advantage plan, you can go from Medicare Advantage plan to another plan or go back to original Medicare and pick up a prescription drug plan. Also, I do regular health insurance, and that period goes into May 15th because the federal government has reinstated the penalties on your taxes if you don't have health insurance. State of California has always had those penalties. But let's go in and start talking about, I'm going to talk about diabetes for a few seconds, okay? Did you realize that 34.2 Americans have diabetes? That means 1 out of every 10 people have diabetes. And I'm one of those people. So I'm going to talk from my perspective. Now, and this number I was really surprised at, 88 million people are pre-diabetic. So that means 1 in 3 people have pre-diabetes.
Right.
That's really something.
Right.
If one of the things I want to say before we get into this is that if you have diabetes or if you don't have diabetes, please share this particular broadcast with your family and friends, because I know as a diabetic, so I'll go into somebody's home and they'll say, well, eat this. It isn't going to hurt you one time. Yes, it is. If you are a diabetic, it is going to hurt you. Diabetes affects every part of our body. And I can tell you from experience, it does that.
Right.
You're higher risk for heart attack. You're higher risk for stroke.
Yep.
Because of the diabetes, I have problems with my pancreas, and the pancreas is what processes the sugars, which affects the kidneys, which affects your eyes, which affects so many things. And we're going to talk about a lot of those other things which it affects.
Right.
When we talk about the neuropathic diabetes today.
Right.
I always say when I meet with my clients and I hear them say, oh, we don't have diabetes, it's like, yay for you. You are so fortunate.
Right.
But you don't realize what a diabetic goes through. And there's so many different ways to go about treating it. Right. So I was thinking earlier today, I think I've been working with my diabetes for about 20 years. I've done it through diet and exercise. I know Amber she and I have talked about this, but the older I'm getting, and I'm a senior citizen, okay, the harder it is to control the diabetes.
So, I think because of our topic, peripheral neuropathy, you listed out for diabetics, the different problems that start to happen with the body. So one of the problems that happens when one is diabetic and or pre-diabetic, just like the stat you just gave, 1 out of 3 people are pre-diabetic. It doesn't matter if you're pre-diabetic or you're full-blown diabetic, the symptoms that you get and unfortunate ramifications of being a diabetic are the same. We have, over my 20 years of practice, I can't even tell you how many people come in who are pre-diabetic that have these conditions, right? Because they always say about individuals being diabetic, you don't necessarily pass away of being a diabetic. It's the conditions that being diabetic cause that start to have trouble on the body as far as disease process. So one of the symptoms of being diabetic, it affects your cardiovascular system. And the thing is, your nerves have vascular flow that go around every single nerve for that nerve to get its nutrition. And these nerves that we're talking about, peripheral, by the way, means away from the body. So peripheral nerves have to do with, the nerves in your hands and your feet. So when people have peripheral neuropathy, neuropathy means that the nerves aren't doing well. So if they have the condition due to being pre-diabetic or diabetic, it's due to the fact that the vascular flow around the nerves are not doing well. So the nerve itself starts to not function and then eventually dies. So there's 3 stages of this condition. And so the important part that I want to talk about, because people are constantly complaining of burning, numbness, tingling, restless leg syndrome. They get discoloration. Their nail beds and nails start to not be healthy. They have red purple feet, and that's what happens with individuals who are pre-diabetic, diabetic. And that's why they talk about the worst case scenario of having amputations, right? So that vascular flow, when it's not doing its job for the nerve, that's the symptoms you start to get: burning, numbness, tingling, sharp shooting, very uncomfortable. The condition people feel during the day, but at night it gets worse. And the reason is because during the day, your bigger spinal nerves are firing all day long. You're walking around, you're moving around, you got your mind, your brain going. Then when you go to lay down at night, that's when it starts to just fire up. That burning, numbness, tingling, restless leg. It's very, very uncomfortable, and people have a hard time sleeping and literally will deal with this for years, mainly because speaking of diet, there is, like, in the professions, of course, there's a time and place for medication, but the medications that they give for this condition, because there's nothing that cures the condition of peripheral neuropathy. Now I'm just speaking of that. The medications are anti-seizure meds and other types of medication that help to numb and dull your neuron response. So you're not feeling the condition. It's not helping with the condition. So when you're talking about being pre-diabetic and diabetic, and that's why someone has this burning, numbness, tingling going on, you are so right about nutrition. And the bottom line is, it comes down to, you have to really watch what intake you're having with not only fruits and vegetables, but also carbohydrates, and making sure that there's a good balance between proteins and carbs.
And that's not so easy to do.
No.
I have diabetes. My husband has diabetes. Okay. And we both treat it completely differently.
Yes. And that's
because our approach to it is so different.
right.
He's selected to be on insulin. He's selected to take all these medications. I mean, and I've selected to do it through diet. But there's that bag of potato chips that's staring at me every time I open up the cabinet.
Yep.
Yeah. Okay.
And that's
put up. I don't have so much problem with this ice cream, because I eat dairy products. Okay. That ice cream is in there. Okay. But it's the potato chips that drive me nuts.
Right. Well, it's interesting. It's such a good point, Janice, because when I talk about diet with pre-diabetics and diabetics, when I say sugar, immediately the mind goes to cakes, cookies, candy, ice cream. But the thing is, you're right. Chips, crackers, cookies, muffins, bread, pasta, rice, all turn to sugar. So that portion control, is so key. And everyone's different the way they go about it. There are vegetarians, vegans, and then there's people who eat animal protein. The neat thing though, if you do it right, you can portion control and you can get what you need to not spike your sugar.
Right. And,
But
and
when systems,
everything spikes your sugar, even fruit spikes
of
your
course, but what I also educate is fruits and vegetables are different types of sugar. They burn differently than bagels, muffins, pasta, rice, crackers, those things. They are a different type of sugar that the body can utilize easier, because of how you utilize them. So it's very important to understand that the point that I try to drive home really is, if you're eating well, you're eating vegetables, you're eating fruits, and then you add, pasta, rice, bread on top of that, that's when you get the spike.
Yeah.
Because we have to have sugars because that's our energy. That's how you feed your body, right? For energy. So
Absolutely.
it's that whole control. With this particular condition, it is so key that one lower, if they're pre-diabetic and diabetic, that they lower their sugar content and amount. They have to do that because they will see a difference with that burning, numbness, tingling. And maybe the patient only has one of those. Maybe they have only burning. Maybe they have only tingling. The one that really drives people crazy is the numbness. The reason I bring this up is because they can't feel, Janice. They can't feel on the bottom of their feet. So they're wall walking at night. They're losing their balance. And to add to that, there are certain medications that are given that I was talking about that are anti-seizure meds. And the thing is, those also, if used too long, can cause balance and problems that way.
That's interesting that you're talking about falling, because a couple weeks ago, Justin, Amber knows who Justin is. Justin Bithell was on the show, and we were talking about falling in the home. And,
yes.
And you're talking about the neuropathy being a cause for falling.
Yes.
And especially in seniors, that's a major thing, is falling.
Yes. It's a huge thing in the 65 and older, because when you cannot feel your feet and you don't know that there's a rug, or you don't know there's a crack, or you don't know what's going on because of your balance issues and you fall, we know in the profession of helping people with their health, when you're older and you break a hip, many times for a patient, that's pretty close to end of life. There's a percentage of people that don't rebound from that. So point being, there are therapies besides the nutrition for diabetics, and pre-diabetics. There are therapies for people with peripheral neuropathy, because being diabetic and pre-diabetic is not the only reason. It can be due to traumas that they've had in the past. It can be due to chemotherapy. It can be due to certain medications, to name one, cholesterol meds. Cholesterol meds eat away at fat, and it's not a smart med. And guess what your nerves are coated with? Their lining is made of fat. So when somebody's on these meds for long periods of time, they will have, not everybody, but a big percentage of people end up with peripheral neuropathy. So the protocols that I use are so effective in helping to create an environment where you're either stopping or slowing the condition from getting worse, or you're actually improving it. People start to feel their feet again. They start having less sharp shooting, less numbness, tingling, burning. And we use, just to give you an idea, because I want to talk about the therapies. People are very interested in, what it is. And we basically use light therapy, which helps to regenerate. It's called angiogenesis. It can actually create more vascular flow. It also vasodilates, meaning it opens up the vascular flow, which, what does that do? It brings in nutrition to those small nerves. We also use another frequency machine that I like to describe it as the old time radios, which I had growing up in my VW bus. You would try to find that station perfect, to listen to that radio station. And this therapy, this frequency therapy is similar to that. And so what it does is it helps to re-educate and get the nerve to function better. So those are my therapies. Now, the question comes down to also, how do you know if somebody has peripheral neuropathy? Well, there are specific tests that you do with those small nerves, Janice. There are nerves that have fine prick, like, if you get a paper cut, oh, ow, or you feel hot and cold. That's a totally different nerve ending. There's nerve endings that can tell vibration. So the energy of vibration. There's the nerve endings that can tell light touch. So you have to literally do these types of tests to identify which nerve fibers are having trouble and then what protocol will go with that. So very important, people come in all the time. They're like, oh, I've had the nerve conduction tests, I'm fine. Well, those are for bigger nerves, which, believe it or not, we both know people can have low back pain. They can have sciatica, and they also can have peripheral neuropathy. It's just two different conditions. So it's not to say that if somebody has peripheral neuropathy, they don't have spinal nerve problems, or if they have spinal nerve problems, they could potentially have peripheral neuropathy.
Yeah, because I know I have asthma.
Yeah.
Which doesn't work with the diabetes, because what they treat the asthma with makes the diabetic levels go higher.
Right.
Okay. And the diabetes makes everything worse.
It does. It really affects, and people, that's the thing, they always think of like the sugar, the diet, which of course is a huge part of reversing diabetes. But the thing is, it's the ramifications if you do nothing about it. Right.
Right.
Excuse me.
And I know one of the things I dislike, okay, I've done that too in the show.
Yeah.
One of the things that I dislike the most is checking my blood sugar every day.
I know, right?
But it's really important to do, because you can see where you're at.
It's so important. And people, I understand, besides the fact that it can be uncomfortable, I know they've made different methods now, but it's so important to see your levels. I'm sorry, I'm gonna grab my protein shake.
Okay.
Sorry. I need something. I forgot to bring water to this. Sorry.
Yeah. And once I'm through with this, I will be having a shake.
Yeah. Oh, good.
Okay. So, so it's so important, because I find when I don't monitor what's going on, that's when all the problems start.
Totally. Because if you don't look at the numbers, how are you going to know what you should and shouldn't be doing? You go about feeling the way you feel, and you're basing it off of symptoms. And unfortunately, even when somebody has a condition, when they're trying to keep it under control, the body's an amazing thing. You could go for days and not have symptoms, and all of a sudden your body's just like, nope, you're done, and you have no energy. You start having all these symptoms, and you go, oh my gosh, wait a minute, I'm not even looking at where my sugar levels are and what I'm eating,
I mean, especially with diabetes, and it goes into the neuropathy, all of a sudden something doesn't feel right in your body. Where did that come from? And you don't remember that it's from your diabetes.
Right.
It could be from something else too.
Right.
The likelihood it's from the diabetes.
Right. And if you're controlling, and because you've done it, the difference of how your body feels because of the changes you've made personally versus when you're not doing those habits. You can tell it hits you very hard, but even my patients that have had chemo and that's why they have peripheral neuropathy, or they've had surgeries and that's why, or they're on different meds and that's what led to it. I will tell you, eating clean, I still work with those patients in regards to that, because again, the vascular flow that goes around those nerves, sugar affects that, whether or not you're pre-diabetic or diabetic. So it's still very important. I tell patients all the time, Janice, they'll come in and they'll say they've been getting treated, let's say, and they're doing better with their pain, right? And all of a sudden a weekend goes by, they come in on a Monday or Tuesday and we're chatting and they say, I was in terrible pain. And I said, well, wait a minute, you've been getting the adjustments, whatever they've been doing. And then I say, well, what did you do this weekend? Oh, well, I went to a birthday party, we had crackers and chips and dip and cupcakes and whatever they had. And then they say, oh, and then that night I had wine. I haven't really been drinking wine, but I did have some wine. So, the difference from the time I saw them last is diet. And it's hard to confront it, but the point is that those are sugars, and sugars cause pain. It causes inflammation, diabetic or not. So when people are in pain, they
you brought up
stay
wine,
away from the sugars.
and you brought up wine, so that means even harder forms of alcohol are going to bring up those sugar levels.
Of course. Well, you know what, people, besides the wine, they love they love cocktails, like margaritas and margarita mix. And, that has a lot of sugar in it. And then, you go to like remember like daiquiris and things like that. Those are it's like, well, and I even educate people because they'll say, oh, Dr. Amber, I juice, but they're talking about going to Jamba Juice and getting this, smoothie, which of course tastes wonderful, but it's high in sugar.
Absolutely.
So, it's the realization of what you're actually intaking, which is so important. And again, back to peripheral neuropathy, when you're having burning, numbness, tingling, sharp shooting, besides the fact that it's a neurological problem, getting the chiropractic and the therapies, you have to still look at what you're eating and how it relates to your symptoms.
Yeah. And eating is such an important thing.
Yes.
It's one of the hardest things to control, because everybody around you is eating something that you really love, but you can't eat it.
Of course.
And people around you are not always your best friend when it comes to food.
No, you're right. The social aspect of food can be very difficult when you're trying to create new habits. Whether it be, going out and sharing cocktails with someone, or going to a party where they're serving different foods that you're not in control of. One of the tricks that and I'm just throwing it out there, that I have my patients take a look at, is when they've gotten in a habit and they're worried because they're going to be going to some kind of gathering with the family or friends. I tell them, one of the tricks is eat before you go, because, the overeating thing could be an issue with some patients. But the point is, if you eat, you're not hungry. You're not, you might socialize more than trying to go over to the table that has the snacks and hors d'oeuvres. And, and then if they're serving dinner, just have a little snack before you go so that you wait for dinner. And there are tricks that you can do to get into a habit, because once you're in a habit, it's actually fairly easy just to push those things away.
But changing those habits,
yes,
are the hard part.
That's right. And well, you know what they say, if you change something for 30 days, you have a better chance of moving forward with that. And I really find that to be true with my patients over these years, as well as my own self and my family members. It does take that amount of time. 2 weeks is not enough. 3 weeks is not enough. You really see people change their habits after 4 weeks to 5, 6 weeks. So, yeah.
And I know that neuropathy was broken down into 4 different types.
Yes.
Of neuropathy.
Mm-hmm.
And it's just, in reviewing information about it, it's overwhelming.
Yeah. So that's why
and now I understand why I have this pain here.
Oh, right. Yes, I know. Right. No, it is an eye opener. I really, because I know people are listening to this, and what ends up happening is they're like, well, how do I even get tested? What do I do to look at this? And that's why, like, patients that come in that either have been diagnosed or are wondering if they have it, it's very, very specific testing that you do. It's very specific. And we do that here. That's what's so neat, because most docs, you come in, you tell them your symptom, I have burning, numbness, tingling. It's bilateral, whether in the hands or feet. And they're like, oh, peripheral neuropathy, Yes, they might do some labs and such. But it's, you really want to know which nerve fibers are being affected. And then, of course, all the labs, the blood work is very important. You want to rule out not just pre-diabetic or being diabetic, but you also want to rule out deficiencies because that affects your nervous system as well.
Oh, yeah, because I could say I just had an instance where, because I became vegan,
Yeah.
and all of a sudden my skin was really dry, and I
Mhm.
started craving salty things like those potato chips that are sitting in there.
Right.
And my doctor did a thorough blood chemistry, and it came out that I don't have any iodine in my system.
Right. You weren't, yes.
Okay, which is the gland.
Right.
If I think I'm in the right area for the
Yeah. Yeah.
okay, and they were swollen, and I was tired, which is part of being a diabetic,
Right.
being tired, and now she has me on supplemental,
Yes.
uh,
To help your thyroid.
an
Yes.
herb thyroid.
Yeah. Good.
My choice of medication or an herb thyroid.
Yeah.
And
It's
so
interesting you bring that up.
yeah,
The,
why
the
you
thyroid.
crave food. But doing the type test that you're talking about, and I know I'm going to be coming in soon,
Yay.
sooner than later, okay, because I've had my second shot.
So yeah, right. I know. We're moving up out of this. It's good.
Yeah, so I'm going to make an appointment because I feel that I have the diabetic neuropathy
Mm-hmm.
in my legs, not my feet, in my legs.
Got it.
And and what you described about laying down, absolutely.
Right. The
Okay.
condition, right, because your spinal nerves are not firing, and then now all the tinier nerves are yelling at you because they've been overtaken during the day.
Yeah. And I'm going, I can relate to this totally.
Yeah, for sure.
Yeah. So it's like really important. And I'm gonna find out. And then the other thing that was interesting this week, I was talking about someone who's gonna be coming on my show sometime in April or May. We're just getting that scheduled. And I mentioned her, I told her to watch this show.
Yeah.
And I ended up giving Amber a referral.
Yes. Yes.
And she, if she's watching the show, I'm not mentioning your name, okay, said she had these feelings.
Right.
And I know Amber could definitely help her out.
Yeah. And there, there's different, the thing is that I want to point out too, because, as a doctor of chiropractic, a lot of us look to structure, they'll say, oh, you go to the chiropractor because you have a subluxation, you have a disc problem, those kinds of things we're known for. But really, when it comes down to it, remember, your nerves control every muscle, organ, gland, and tissue in the body. And so when you come to us, our study background has so much to do with neurology and how it affects us, from everything from what we're talking about now with peripheral neuropathy to radiculopathy, like sciatica, carpal tunnel, thoracic outlet syndrome. There's so many things that we help. You brought up asthma. We help people who have asthma because when you're taking the pressure off the nervous system and helping to create more function, there's certain areas of the body that control your lungs that you get that help with when you get the chiropractic and the muscle therapy. So and we, nowadays clinics like mine are very innovative. And so there's different therapies. That's why we can help people without the use of, medication and, over the counter things, because we basically have these therapies that can help improve their lifestyle, and their symptoms.
I know as I was growing up, and a lot of people probably watching are in my age group, we were brought up that, oh, why would you go to a chiropractor? Okay.
Right.
You don't really need that. That's how I was brought up.
Right.
Over the last 5-6 years, I've been learning what chiropractors actually do.
Right.
And a lot of chiropractors have specialties that they go into. And I know Dr. Amber, one of her specialties is nutrition.
Yep. My niche, we do a ton of nutrition here. And when I first started, my niche was balancing hormones naturally. Yeah. And so and I come from a background of nutrition. All the training I've had has been based on not just the chiropractic function neurologically, but also the nutrition. And that's a huge bonus for people, because it's so holistic. You're looking at the whole picture.
And I see that medicine is changing, because
Yes.
15 years ago, it was still the same way. Medicine was still the same way. They're going to write a prescription and take care of it. Where now they're looking at different ways.
Right.
Years and years ago, doctors never had any education in nutrition, which
Right.
is like mind-boggling to me.
Right.
Where when I speak to chiropractors, a good portion of their education is in nutrition.
You have nutrition the whole time you're in school. It's
Yeah.
not even like, my good friends who are medical doctors, we always joke because they're like, yeah, we get a weekend crash course, but in their defense, they practice medicine. That's what a medical doctor is. They practice medicine. So of course they need to know all of that study, because that's what they practice. And we need that. But there's also the other end, is everyday life of what you eat. What they say, what you eat is what you are, right? I mean,
and since World War II, okay, because I want to go back to that far, the way we eat, the fast foods that we eat,
yes,
the processed foods that we eat,
yeah,
okay, they don't help our bodies at all, especially
right.
for diabetics.
Right.
It creates the problem. Now, my assistant, she'll probably punch me, okay? she's definitely watching this. Since the pandemic has started, she stopped eating fast foods.
Right, because people, right, they weren't going out as much. So now we were eating, at home and bringing lunch. Yep.
And she's lost 40 pounds.
Oh, that's fantastic. Yes, that happened. A lot of individuals, because you're right. When my kids were little, I would tell them, because, they saw the commercials, they wanted McDonald's, they wanted fast food, and I would call it non-food. That's non-food. That's not, there's nothing good in that food. And so they grew up literally looking at fast food as non-food, right? And like you brought up World War II, after that, besides the fast food, our soils were turned. We had no nutrition, vitamins, minerals, which someone with disease process needs more than ever, right? And then in 1994, everything went genetic modified. So there's this problem with nutrition in general, right? We're not getting the vitamins and minerals that we should be. So you're seeing a rise in all of this autoimmune disease, the body attacking itself, and different disease process, cancer, heart disease.
Right. But it definitely affects people who have diabetics.
Yes.
Diabetic. I remember my father, who I totally loved, and he's been gone 38 years.
Okay, yes.
And I remember way back when he was alive, and he would talk about having diabetes,
right,
and his calories, and he would say, I'm quoting him, I'm just going to blow those calories away, okay? As he's eating that fast processed,
right,
non-nutritional food.
Okay? Right.
And it's just not that way anymore.
No. There's so many, I think, especially, well, obviously with technology, we've all, evolved into all this knowledge of knowing, nutrition, whatever you're interested in, I know, but, people are way more aware of what they're eating, the nutritional value of that. I do have to say this though, real quick, because it's an interesting thing. I live here in Southern California, and pretty much everywhere you go, there is a nutritional store. Like you can go to Sprouts, Mother's, Whole Foods, wherever you're going. I mean, even at Albertsons, Ralph Stater Brothers, they have organic option, right? And meats with no hormones, no antibiotics. It's an interesting thing. I think it was 3 years ago, might have been 4, but I feel like it was 3. I went to a convention in Missouri, and I had this crazy problem with flights. We were missing flights and there were storms. Anyway, I was dropped off in this podunk town. I don't remember the name. And I thought, oh, there's got to be something, or I had to rent a car because I had to drive. I think it was to Branson, Missouri. Anyway, I literally had like a 2-hour drive at this point. And I get in the car and I'm looking for a place to eat, and there was nothing. And when I finally got into this gas station, like a trucker gas station, the healthiest thing was like hard boiled eggs and like a pickle.
Oh my
The
God.
lady was like, well, you can have, we have these sandwiches over here, but it was all like fried. But the point is, I thought, oh, it's night, whatever. By the time I get to where I'm going, I'm sure it'll be fine. But throughout that whole state, and I guess my point is, I'm lucky for where I live, for the lifestyle that we demand in this area, because that's what it has to do with.
Oh,
It
it
was
is,
very interesting.
definitely.
Yeah.
Definitely lifestyle. But one of the things that I noticed, Amber knows I go to Hawaii a lot,
Mhm.
just for relatives.
Mhm.
But when I'm in Hawaii and I'm on my family's farm,
So cool.
my blood sugars are always lower.
Yep. Well, you're eating clean and you're eating organically. Like, you're getting the nutrition you need from what you're eating.
And even now I can come home and eat the same thing.
Yep.
But it's not like there. Now, like mango was supposed to be really high in sugar.
Right.
I can eat mango all day there and still have a normal reading.
Yeah. It's fascinating. Well, and I also do feel like stress really, and it's been proven again and again in studies, your adrenal glands tell your body how you're dealing with stress, whether it's physical, chemical, or emotional, right? It's pretty fascinating, when you go away and you're in an environment that's very holistic, natural, you're eating clean, just a different scene. I remember when I guess it's been like 8 years, I went to Indonesia, I went to Bali.
Oh.
And everything that they feed you there is literally right off of their farm right there, and the difference I felt in energy and sleep. And we were going, like we were doing, and because I only had a certain amount of time to be there and I wanted to experience Bali. Wow. So it's, if I was here doing that same boom, 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 you know what I mean? My stress level would have been high. I wouldn't have felt good, but I felt so great while I was there. I didn't have any gas, bloating, distension, digestive stuff. My energy was good. I slept well. It's pretty interesting. The food, the nutrition, and the value of that, and the environment in regards to the level of stress really does affect your health.
Yeah, just living under the conditions we're living under now.
Yeah.
Okay.
Right.
People are finding it very stressful.
Absolutely.
And being stuck in your house and not doing anything.
Yeah.
I mean, I've been trying to find ways. Instead of walking this way in my house, I can walk 10 steps longer. I'll go that way.
Yeah.
I'm trying to find a way. But because I know I'm diabetic, I'm sure a lot of people that are listening to this are diabetic.
Yep.
That exercise is so important to keeping those blood sugars down.
Yep. It's interesting too, like, just to talk, I'll circle back to the peripheral neuropathy real quick. People who have that condition, and it's, they're really suffering from it and they've had it for a long time. It is so painful. Speaking of exercise, they have a really hard time with that. So, I want to encourage everybody to really look into these different types of protocols and modalities, along with nutritional support to help you, because when you start to feel better, you become more active, you just do better, your demeanor's better. There's so much that goes along with having that much pain, and I just hate to see people suffer, because it's terrible. I mean, and I recently had a patient who loved to dance, and literally said to me, if this is going to go the opposite way of where I think I'm going, if I can't get the help, I'd rather just be done, because that's how much the person loved to dance. And, this person's been dancing for 50 years.
Oh,
And,
yeah.
it's terrible. And lifestyle changes and what people put up with, if I could encourage you out there, you individuals out there that are suffering with it, please seek out help, because, it's not there are solutions, is my point.
Yeah.
People get really stuck in, look, this is all that they have to offer me, but there are other things out there, like myself.
The neuropathy also affects your intimate life.
Absolutely.
It affects both men and women.
Yep.
intimately.
Yep.
And that's a big deal on relationships.
Absolutely.
Okay.
It's a very big deal. And people, and again, that's what I don't know. I just want to encourage people to, reach out, seek, if you're listening to this and you're not in, this area in Orange County, please, look, because there are clinics and there are holistic doctors that are doing methods that'll help you,
Okay. Now, are you finding that integrated doctors?
It's interesting. Integrated doctors, a lot of them deal with pain. They deal a lot with autoimmune. They deal a lot in stem cell prolotherapy. There are some that deal with the peripheral neuropathy. I've had a few clinics that I know of, like in Southern California, not necessarily Orange County, but Southern California, that really focus their clinic on peripheral neuropathy. But typically it's chiropractors that have the modalities, because we basically deal in neurology. So yeah.
So I just want to tell everybody, it's so important that if you're pre-diabetic, even if you have gestational diabetes from being pregnant, which is usually is a sign, because I know when I was pregnant, oh my God, 39 years ago, I had gestational diabetes. I know I like to call her she's my stepdaughter. My niece all have gestational, and
Right.
I know their backgrounds, and they're getting a look into the future.
Right.
What's there.
Right.
You need to start controlling it now.
Right.
And because diabetes does not go away.
Right. That's right. It has to do, well, a lot of doctors and people will call it a hand to mouth disease, because you're right. You don't realize the future. You don't realize what you're doing now is going to cause, ramifications later, right? And when you're young, you're invincible. So it's very important, if you have a family history, to make sure that you are doing the right methods, just so you don't have to go down that path, really.
Yeah. And I would say to people, listen to your body.
Yeah.
If your body's telling you something's not right,
listen
to it. Yes, I'm not going to tell anybody they shouldn't go to their doctor, but look what is available to you. And in this day and age, we have so many things that are available to us.
That's right.
And for those of you that don't have diabetes, understand what your diabetic friends and relatives are going through.
Right. Help them.
Help them, because it's not fun. So when I say I can't eat that because I'm diabetic,
right,
don't say to me, one time's not going to hurt, because there's
exactly
always that one time.
Yeah. And the considerateness of, like, when you're bringing something to a party or a gathering, especially because now, I know we're going to be moving into that in the future again, just making sure that you try to have healthy choices as well, so that you can help everybody. It's not, everybody who's coming.
Yeah, because what that diabetic is doing is trying to control it. And when you're sitting there and you're looking at that one of my favorite things is watermelon. Okay.
Right.
It will spike my sugar level up.
Yes.
And I love watermelon, and I'm looking at everybody enjoying it.
The watermelon, right?
Watermelon. This is something basic, and I'm going,
no, I
want a piece of watermelon. Okay.
Yeah.
I want to eat that piece of cake.
Yes.
Okay. And to force it on them when they're doing the hardest, that's the same thing with anybody that's trying to take off weight, okay?
Yes.
Yeah. Please don't force it on them.
Yeah, no, exactly.
You're not helping them. And I know if you bake that or you made that particular,
I know. They want you to indulge.
want people to try it, but if you care about that person,
Yeah.
don't do that to them.
Yeah.
Okay.
Yeah.
Well, one of the things I want to do is we're going to bring up how to get a hold of Dr. Amber.
Mhm.
She's great. She's been on my show several times. So if you want to go back either onto Janice Wood, Independent Broker, and bring up all the shows, you're going to find Dr. Amber on here with a wealth of great information. Also, Dr. Amber does her own social media shows, and you can go into what, Voitenko Wellness.
Yep, it's Voitenko Wellness on Facebook, and then it's Voitenko_wellness on Instagram.
Okay. And I'm also on Instagram, and I think we're now starting to post on LinkedIn. And I'm looking forward to putting this into a podcast library.
Yay.
What we're talking about. Yeah. And there's just so much great information that Dr. Amber has about your health. Every show she's been on with me, we've had, just like today, we can go on for another hour without
Right.
okay. Just a wealth, from how to, the collagen and why do you need collagen? And we've talked about so many different things, and my mind
it's been great
right now. And I know I will have her back again because she has so much information available to her. She's going to classes, she's doing classes. I mean, so please, think of Dr. Amber and look at her. Also, there's my information. If you're needing Medicare insurance, if you're lost in that Medicare world, or if you have any questions about regular health insurance, we're there to help you.
Yeah, that's great. Thank you so much, Janice, for having me on. And, I always let everyone know for my patients, because I am a Medicare provider, I have many, many times referred Janice, and she's a wealth of knowledge and helps people really get what they need insurance wise, which is very important. So thank you, Janice, for having me on, and thank you for your services.
And if anybody really has taken away some good information from today, please share it on your Facebook page or on your Instagram page or on your LinkedIn page. We love you to share it because we really are concerned about making sure people are healthy. And diabetes, I just know as a diabetic, it's a fight every single solitary day.
Yep. And people who suffer with the peripheral neuropathy, it's a fight. It is. And they're suffering. It's terrible. So
and I just, now I'm going backwards a little bit. I remember years ago, I dated a gentleman and he actually lost one of his legs.
Yeah. Yeah.
And it happens today.
Yeah. It's devastating.
Because people ignore the signs that their bodies are giving them. And yes, I love to eat that wonderful piece of pizza with all that gooey, and watching all those food channels with all that wonderful food does not help us.
Right. It's true. And honestly, just like you just said, you got to watch your body signs. And when you start to lose limbs, that takes away your freedom and your motivation and your abilities. And it's, it can be avoided, like you said. So yeah, please share what we've just discussed.
It's just devastating. Yes, you can take insulin, but it's not a cure. It's just masking the signs.
Right.
You still have to take care of it.
Maintain. Yes.
And I don't know how to stress that anymore.
Yeah.
It's just, it's not fun being a diabetic.
No. Agreed.
It's just not fun. And there's just no other way to get around it. And I know I'm talking from experience.
Yes. Yeah. Exactly.
And I would love to have that big bowl of spaghetti with all the cheese and stuff on it.
Right.
Or that ravioli. And my weakness is bread.
Yeah. Yeah.
And different breads spike. Sometimes it doesn't.
Absolutely.
again, we can go on forever. And I feel like that's what we're doing right now.
It's easy, but yes, well, thank you for having me. I appreciate you.
I love doing it with you, and we'll come up with something again for
Yes, I'll be on
down
soon.
the road. Yeah, and well, I see you every week because we
Yep.
go to the same meeting together every week
Yes.
on Zoom, and it's almost going to be a week since I've had that second shot. So I
Oh,
will
yes.
go in your office, and I will be getting a Medi-Pedi.
Yes. Good. Yay.
Okay. Okay. Thank you.
Thank you.
We'll just